Assalamu alaikum everyone, and today we will be demonstrating the extraocular movement assessment. And during this skill, we will talk about three different types of eye movements. We'll talk about saccades or saccades. Saccades is more appropriate, which are rapid eye movements that allow you to point your eyes towards an object of interest. Then we will be talking about pursuits, which is the most important component of extraocular muscle testing. And these are slow tracking movements which allow you to follow your objects of interest. And these are also called conjugate movements because both of your eyes are moving in the same direction. And that happens because a particular muscle in one eye is paired to an other muscle in the other eye, a complementary muscle, and both of these muscles are then called yoke muscles. Yoke muscles are like yoke on a horse, so that when you are or a yoke on an aircraft, so that when you want to turn, you are pulling the ropes in a way so that you are tightening one and relaxing the other. And this is a very similar mechanism by which muscles in both eyes either contract and the opposite muscles relax in both of the eyes. So these are the most important movements that we will do or talk about. And then finally, we'll talk about vergence movements. Vergence movements are movements of the eye in opposite direction, and they are called disconjugate movements. So convergence and divergence. Of all of these three, as I said, pursuits is the most important component, and we'll just talk about all these three as we move along. So saccades is tested by asking the person to, or your patient or your case, to rapidly shift the gaze between two different objects. And what we mostly do is show a fist and a palm at an appropriate distance and positioning, as you'll see in the video, and ask the patient to either look at the palm or the hand by moving the eyes and not by moving the hand. Pursuits are tested by making your subject or your patient or your case follow a target in an H-like pattern to either cover the six positions which are called the cardinal positions or the 9 diagnostic positions of gaze. Almost all of the time it is 9 diagnostic positions of gaze. What are cardinal positions? Cardinal positions are when one muscle in each of the eyes is moving the eye in a particular direction. And 9 diagnostic positions of gaze add 3 additional positions to that: straight, looking up, and looking down, where more than one muscle is involved. We'll just get to these in a bit. Pursuits can be tested in both eyes, while both eyes are tested together, which is called version testing. Or you can check pursuits in one eye. Obviously, you can't stop one eye from moving. So what you do is you cover one eye and you are only checking movements in the uncovered eye. And those are then called ductions testing. When you are, or you have a station in your OSCE of extraocular movements, and you are told to perform extraocular movements, it is understood that you will be testing versions, unless you are specifically told to test ductions. Ductions are only tested when you pick up an anomaly during version testing. And if you do pick up an anomaly, you can ask your examiner, should I do duction testing and then do ductions? Don't start off by doing ductions. You'll be wasting your time. Ductions are not required if the extraocular movements are normal in your case or subject. And even if they are not normal and you have described the anomaly, only do ductions if your examiner at the station or during your clinic or your mini CEX or otherwise tell you, yes, perform ductions. Vergences are simply by asking the patient to follow an object as it gets closer to him or moves further away. When it's getting closer, it's convergence. When it's going further away, it's testing divergence. So one thing that I'll sort of talk about in a little bit is the difference between extraocular muscle functions and extraocular muscle testing. Both of these are different. Now, your eye is a sphere and it is surrounded by muscles, and those muscles apply a rotatory force on the eyeball. And because your eye can be in any position and it can move in any position from any position, so the muscles have really complex functions depending upon where the eye was when the muscle started to function. So the eye could be in a primary position or a secondary position or a tertiary position, which makes it very difficult to actually remember all the functions. You can if you're a physiologist or you're interested in it, because it's not an impossible task, especially once you understand the anatomy of the extraocular muscles. By anatomy, I mean how they attach or insert onto the eyeball. But as an ophthalmologist, we are only interested in testing if a muscle works or not. And is a muscle able to appropriately move the eye as much as it should? And that simplifies the procedure because then we have something called cardinal positions, which are six positions in which one muscle would move one eye in a particular direction. And that's very simple because when we know that the eye can move in this direction, we know this muscle is working. If it moves to the extent that it's supposed to move, so the muscle is working and its nerve supply is also working. Usually, with that, we add three other positions and they become 9 diagnostic positions of case. So when you have your assessment in your OSCE, you're expected to do the 9 diagnostic positions. You make a 3 limbed H. We'll just demonstrate that as we move along. So these are muscle functions. And as you can see that apart from the median and lateral recti, which only have one function, every other muscle has a different function depending upon where the eyeball is. Primary function is when the eye is in primary position. Primary position is looking straight. A secondary function is when the muscle starts working when it's in any of the secondary positions, left, right, up, down. And a tertiary function is when the eye is in one of the oblique positions, up, left, up, right, down, right. So remembering this is really difficult and we don't do this. So muscle testing is infinitely easier than the muscle function bit, and all we need to do is to follow this table. And when we are testing the medial or lateral recti, we just move the eye laterally or medially, and the starting position for this test is when the eye is looking straight. For the recti, the starting position is when the eye has moved laterally, and the superior rectus then move eyes upwards or downwards, depending upon which eye you're talking about. Why do we need to move the eye laterally before we test the superior and inferior recti? We'll just get back to that in a bit. And for the obliques, you need to move the eye medially, and then the superiorly oblique moves the eye downwards. If this is this eye, medially and downwards, and the inferior oblique moves the eye upwards. So why do we need to put a position, put the eye in a lateral or medial position before we can test the recti or the obliques? Well, that's because these muscles do not attach to the globe along the axis of the globe. They attach at a certain angle. So if I can, so this is what I mean by that. So these are the two, this is the same orbit. This is the right eyeball in the right orbit. This is from looking at the top. So there is the cranial cavity and the cranium has been removed and the floor of the orbit has been removed in this case. So this is the same eye, superior view, inferior view. This is the superior rectus and this is the inferior rectus. This is the inferior oblique and this is the superior oblique. Now the red line, this is the axis of the eyeball. Okay, and this blue line, dark blue line, is the axis of the superior and inferior recti muscle. And the green lines are the axis of the superior oblique and the inferior oblique muscles. Now, I am assuming that you remember the origin and insertion of the extraocular muscles. If you don't, you can go back to your SPS sessions, or you can just quickly review from any of the multiple sources that are available. But honestly, it's not that much of a big deal. I'll just quickly go over the superior and inferior rectus. They both originate at the annulus of Zinn, and they attach on the eyeball by making an angle of 23 degrees to the axis of the eyeball. So you can see this red line is the axis of the eyeball, and this blue line is the axis of the superior rectus, and it makes an angle of 23 degrees. This is the lateral side of the orbit, and this is the medial side of the orbit. Similarly, the inferior rectus muscle also, when it attaches to the eyeball, it makes an angle of 23 degrees with the axis of the eyeball, so you can see here. And the superior oblique also arises from the posterior aspect of the orbit, travels along the medial wall, and it sort of takes a 90-degree turn at the trochlea, which is located right here, and attaches to the posterior, superior, and lateral part of the eyeball. The inferior oblique arises from the medial side of the floor of the orbit, so someone back there, not at the very edge of the orbit, a little bit backwards, and it attaches to the posterior, inferior, and lateral quadrant of the eyeball. So it is sort of cuddling the eyeball like this. The superior oblique is the posterior superior lateral, the inferior oblique is posterior inferior laterally, and they're cuddling the eyeball. So if this is the eyeball in between, this is the eyeball, so they are cuddling the eyeball like this. So both of the oblique muscles make an angle of 56 degrees with the axis of the eyeball. So the recti make an angle of 23 degrees, the obliques make an angle of 56 degrees. So if I just sort of move the orbits into background, so show you these lines. Now what we need to understand is that, remember, to test the recti, the superior inferior rectus, we need to move the eye laterally. That is because when you have the axis of the eyeball parallel to the axis of either the recti or the oblique, the recti or the oblique can only, for the recti, they can only elevate and depress when the eye has moved out. For the obliques, they can only elevate and depress when the eye has moved in, because the axis of the eyeball and the axis of the muscles have aligned. So I'll just show you that. So this is the same diagram as this, but we have just magnified everything. And this is the inferior rectus, this is the superior rectus, this is the superior view, inferior view, this is the medial wall, lateral wall, lateral wall. And remember, the superior and inferior recti were making an angle of 23 degrees, while the superior oblique and the inferior oblique were making an angle of 56 degrees with the angle of, with the axis of the eyeball. So what happens when we move the eye laterally? The axis of the eyeball and the axis of both the superior rectus and the inferior rectus are parallel with the axis of the eyeball. So we'll just do it once more. The eye moves laterally, and the axis of the eyeball and the axis of both the superior and inferior recti muscles are now parallel to one another. So when the eye has moved laterally, there is no angle between the axis of the recti, either superior or inferior, and the eyeball. So now the recti are pure elevators and depressors. Superior rectus would elevate and inferior rectus would depress. But this is only true when the eye has moved laterally. So that is why when you are testing this, the recti muscle, the superior and inferior rectus, the eye has to be moved laterally first. For the obliques, the opposite is true. So let's move the eye back to the primary position, straight ahead. The eye needs to be turned medially. And when the eye is turned medially, the axis of the eyeball is parallel to the axis of superior oblique and inferior oblique. There is no angle between them. And now the two obliques either elevate, which is the function of inferior oblique, and depress, which is the function of superior oblique. Yes, I get them right. Inferior oblique elevates and superior oblique depresses, because the inferior oblique is attaching at the posterior inferior quadrant of the globe, and when it contracts, it pulls the eyeball upwards. It rotates the eyeball upwards. Trust me. So this is why we need to move the eyes laterally to test the recti and medially to test the obliques. Now, one thing that you might have noticed is that when the eye moves medially and we are testing the obliques, it seems that some of the eye is actually turned inwards. Like it seems to be going into the orbit, and as you'll see when we see the movement videos, that is actually not incorrect. That is how it actually happens, and we'll see when we get there. So let's just leave the eyes in primary position again, and I'll just show you this little video. And what I'll do is I'll start the video and start the animation again, and you see the eye would move laterally first. So this is the medial part of the eye, this is the nose, so that's the lateral part. And when the eye moves laterally, and you'll see on the animation how the axis of the eyeball and the axis of superior and inferior recti become parallel to one another. So in this position, when the eye is in this position, it's moved laterally. There is no angle between the axis of the eyeball and the muscles. So now the recti either elevate or depress the eyeball. Superior rectus elevates, inferior rectus depresses. And they can't perform any other movements because the axis of the eyeball and the muscles are parallel to one another. Similarly, let's see what happens when the eye moves medially. And again, this is the medial side, this is the nose, and that's the lateral side. And I'll start both at the same time. All right, so the eye has moved medially. As you can see, the eyeball seems to be going inside the orbit, which is not incorrect, because because you need to move the eye inwards, and it's 56 degrees, remember? So the eyeball has to be moved inwards as much as possible so that the axes of the eyeball and the oblique muscles are parallel to one another. And now inferior oblique will only elevate and superior oblique will only depress. To test superior inferior rectus and superior inferior obliques, the eye either needs to be laterally or medially moved. We'll see that how that goes when we actually see the video. So the prerequisites for this is you just need a room where you can sit comfortably and you can adjust yourself with regards to your height so that you are at the eye level, and you can also adjust the distance. And so the area should be comfortable for you and your patient that you'll be testing. So these are the 9 diagnostic positions of gaze. The 6 cardinal positions are in black, and we add these 3 positions, which gives us the 9 diagnostic positions. The cardinal position is one muscle in each eye moving the eye in one direction, and the cardinal position involves more than one muscles. And this is the terminology that's used to describe eye movements. So when you're looking upwards and towards the right, it's called dextro elevation. When you're just looking towards the right, it's called dextroversion. When you are looking down and right, it's called dextro depression. Similarly, looking up and left, levo elevation, looking to the left, levoversion, looking to the left and down, levo depression. Looking up, supraversion, looking down, infraversion, looking straight is like straight ahead. All your muscles are working to hold the eyeball in a straight ahead position. So when you're testing ductions, you simply cover one eye. You can use the palm of the hand of the patient, or you can use an occluder, whatever you have. And then you are testing the muscle in which the muscle of the eye, which is visible to you. These terms are then called duction. So when you're looking upwards and towards the right is dextrosupraduction. Towards the left, towards the right, sorry, dextroduction. Towards down and right, dextroinfraduction. Upwards, supraduction. Downwards, infraduction. Upwards and to the left, levosupraduction. Looking to the left, levoduction. Looking down and to the left, levoinfraduction. But since you don't really need to, if you do remember these terminologies, it is very good and you do get extra credit. But if you don't remember, you can just say the eye does not move down and out, or to the left or to the right, or up and out, or up or down, depending upon if you see an anomaly. But if you remember these terms, you do get a little bit of extra credit. So like you test the ductions in the right eye, you can also test the ductions in the left eye. You just cover the opposite eye, but you have to remember that in order to test the obliques, the eye needs to move medially first, then upward movement is for inferior oblique, downward movement is for superior oblique. When you want to test the recti, the eye has to move out or laterally. Superior rectus moves the eye up, and inferior rectus moves the eye downwards. So remember, we talked about that the eye has to move a certain amounts medially or laterally before you can test the superior and inferior recti and the obliques. Well, then we need to know where the eye needs to be, or how much should the eye move, i.e. what are your limits of horizontal movements that's acceptable. Well, for lateral movements, the landmark is very simple. Your temporal limbus should be at the outer canthus of the eye, or the lateral canthus of the eye. So this is the lateral canthus. Lateral canthus is this bit where the two lids meet laterally. So this is the lateral canthus of the right eye. This is the lateral canthus of the left eye. This is the lateral canthus of the right eye. This is the lateral canthus of the left eye. So the temporal limbus should be at the lateral canthus, and that's the normal movement. For the inward movement or the medial movement, the landmark is your punctum. And the medial third of your cornea should be inside the punctum. Remember when we saw the animation, the eye had moved quite a bit inside. So this is the point where it has moved inwards, then where the depression and elevation action of the obliques can be tested. So this is the limit. This is the normal position of how much the medial rectus can actually move the eye inside. So for the lateral rectus, it's very simple. Temporal limbus or reaches the lateral canthus of the eye. For inward movements of the eye, it is the landmark is the punctum, the inferior punctum, because that's something that's visible. And the medial third of the cornea, the inner third of the cornea, should be inside this landmark or the punctum. And this is also true for the other eye. If I can show it in the other eye, this is very simple. The temporal limbus should be at the lateral canthus. For your inwards movements, the landmark is again the punctum, the inferior punctum, and the medial third of your cornea should have moved inside your the point where the inferior punctum is. So this is something that's really important, and you should be noting it. And the examiner, when you're performing these movements, is noting, are you moving your finger enough so that the eye is reaching these landmarks? So you're not just doing this, you're actually moving it fully. So now we are going to see an actual movement, and I'll list the muscles as they go, and I'll also make an H at the bottom. So the movements are being recorded at the bottom, and you need to lift the lids when you're looking up or down so that you know that your eyes have moved. And for the recti, the eye has to move out. For the obliques, the eye has to move in before you can test them. These are the cardinal positions: up, down, and straight. All right, we'll talk about vergence and saccades or saccades now. As I said, we spent quite a bit of time on pursuits because they're the most important set. The vergence movements are movements in the opposite direction, and they basically help you keep a focus when things are getting close to you or moving further away from you. So when you're reading a book, your eyes are supposed to converge, and when you are sort of taking things further away, they diverge. So convergence is testing whether both your medial recti work in synchronicity to move the eyes inwards. Your eyes are moving in the opposite direction, remember, and divergence checks whether your lateral recti can work in synchronicity with one another to move your eyes further apart. Saccades test rapid eye movements, and they are tested in vertical and horizontal gazes at an undergraduate level. And again, as I said, either an open palm or a palm and a fist, and asking the patient to rapidly shift between the targets. So we'll just see a video as to how this is done. These videos, these clips are also coming up later when we test the extraocular movements, the entire video. So this is vergence, and first we'll test convergence, where medial rectus of both eyes are moving the eye inwards. And then we'll check divergence, in which the lateral recti are being tested to move the eyes further apart. So saccades are tested by rapidly moving the eye horizontally and vertically, and these are the muscle groups involved in the right and left eye. The movements are so fast that there was little point in writing them as the movements were happening in real time, as we did for vergence and pursuit. So I put the appropriate muscles at the bottom. Now it's time to record our findings, and to record our findings, we record all three: vergence, and saccades. Vergence are tested by pursuit, so we make our modified H for both the right and left eyes, and we put a check mark against all the muscles or the muscle groups which performed or were acting normally and were moving as much as they were supposed to do, and we do this both for right and left eyes. Sometimes the assessment or the examination is modified, so you might be asked only to examine the right eye or the left eye. Sometimes you're only asked to do vergence or pursuit, so you should be familiar that when you're asked to do vergence or pursuit, it means the same thing. So this can be modified. And rather than drawing these figures after completing all three movements, pursuits, vergence, and saccades, draw this before, so that you only have to record your findings later. Else you'd be drawing and then you'll forget what you saw and you'll be going back and doing it. So draw these things first for all three: vergence, and saccades, and then plot down your findings once you're done with the test, so that most of the legwork for recording has already been done before, and you only need to put check marks. So vergence movements are recorded by writing convergence, divergence for right and left eye, and again putting a check mark if everything is okay. Saccades are tested by drawing these cross arrows and putting a check mark against movements that you saw were fine. To record abnormal movements, abnormal findings, what we do is remove the check mark and we put an X, And we put an X depending upon how much of the muscle was functioning. Sometimes the muscle is paretic, sometimes it's paralyzed. So if our lateral rectus wasn't able to move the eye all the way out, it just moved half the way temporally or outwards, we put an X here. If it couldn't move all the way out, we'll just put an X here. So for example, it could move maybe nearly 90%, but not all the way out. So we put it here. If it can't move at all, we'll just put an X here. It is also possible to have multiple muscles not working, because remember the third nerve is supplying multiple muscles. It is supplying LR6, SO4, O3. So apart from lateral rectus and superior oblique, everything else is supplied by the third nerve. So if your medial rectus and superior rectus are not working, so you remove the check mark and you put X's here, and because the lateral rectus is working, you put a check mark there. So it is possible for multiple muscles not to work, and that is why it's easier if you have drawn this before, so you don't have to draw and also recall what you saw during the testing. So you just put your appropriate marks where you saw the muscle working appropriately or not. For vergence movements, it's just similar. Remove the check mark, put an X of what you saw not working. So if the right eye wasn't converging properly, you put a cross mark. And the same is true for your saccades or saccades. You remove the check marks and you keep producing, or just put an X where you saw the saccade wasn't taking place properly. And that is how you record your findings. So now what is going to follow are the actual videos, and please see those. If you have any questions, please do post in your WhatsApp group so that we can clarify anything that's left. Thank you very much. Assalamu alaikum everyone, and we are going to show you a demonstration of extraocular movements. The first video will show you a bird's eye view or a zoomed out view of how to appropriately start the skill, including setting up the distance, setting up the level with respect to your patients, and the positioning of your hands and the target that will be used during the testing. Once this is over, we'll have another video, a close-up video, which will demonstrate the actual movements of the eyes during the testing. So two separate videos, and the first one is just going to begin now, and I'll introduce the second video when it begins. Assalamu alaikum. मेरा नाम डॉक्टर अली है। आज मैं आपकी आंखों के पट्टों का मुआयना करूंगा। मुआयने के दौरान मैं आपको अपनी उंगली दिखाऊंगा। आपने अपनी आंखें उस तरफ घुमानी है जहां मेरी उंगली हो, अपना सर नहीं हिलाना। क्या आपकी इजाजत है? ठीक है। The first thing that you need to check is that you are at the eye level of the patient, so make sure that your eyes are the same level of the patient, and you need to be 1 meter apart. So the idea is that you are at the shoulder level and you move back a bit, so that's about 1 meter, and the target should be midway between yourself and the patient, unless you are doing convergence in which the target will move closer to the patient. ठीक है? आप अपनी बाईं आंख को अपनी आंख की हथेली से बंद करें। बाईं आंख को, आपको मेरी उंगली नजर आती है? इसी तरह से दाईं आंख को अपनी हथेली से बंद करें। आपको मेरी उंगली नजर आती है? ठीक है। अब अपनी दोनों आंखें खोलना है। आपने मेरी उंगली की तरफ देखना है, जहाँ मेरी उंगली जा रही है अपनी आंखें वहां घुमानी है, अपने सर को नहीं। So we're going to make the 3-limb H, and we'll have a close-up of the shot. When the patient is looking towards the inferior gazes, you can lift the eyes. मैं आपकी आंख को हाथ लगाऊंगा। मैं दोबारा से आपकी आंख को हाथ लगाऊंगा to get a better idea of rotation of the eyeball. You can shift your fingers once you're in the opposite direction if it's easier for you. मैं दोबारा आपकी आंखों को हाथ लगाऊंगा। मेरी उंगली की तरफ देख रहे हैं। Now we're going to check convergence and divergence. ठीक है, मेरी आंखों में देखते रहिएगा। मैं आपको अपनी मुट्ठी और अपना हाथ दिखाऊंगा। जब मैं आपसे कहूँ हाथ की तरफ देखें तो हाथ की तरफ देखना है, जब मुट्ठी की तरफ देखें कहूँ मुट्ठी की तरफ देखें तो मुट्ठी की तरफ देखना है। आंखें घुमानी है, सर नहीं घुमानी। Hold up your hand one way as a fist and the other as an open palm, midway between yourself and the patient. Spread out a little bit. मुट्ठी की तरफ देखें, हाथ की तरफ देखें। मुट्ठी की तरफ देखें, हाथ की तरफ देखें। मुट्ठी की तरफ देखें, हाथ की तरफ देखें. We are checking sockets. Now in the vertical position, मुट्ठी की तरफ देखें, हाथ की तरफ देखें, मुट्ठी की तरफ देखें, हाथ की तरफ देखें, हाथ की तरफ देखें, मुट्ठी की तरफ देखें. आपका बहुत बहुत शुक्रिया. Okay, the second video which demonstrates the movements of the eye will begin momentarily.